One way to effectively remember the signs of a stroke and what to do is by using the acronym F.A.S.T. Suppose you suspect that you or someone else might be having a stroke. In that case, the National Stroke Association recommends using the F.A.S.T. test. F.A.C.E. Check for drooping on one side of the face when the person smiles. A. RMS. Observe if one arm drifts downward when asked to raise both arms. S. Speech. Assess for slurred speech or difficulty repeating a simple sentence. It is crucial to take urgent action when someone shows signs of a stroke, so seeking medical attention and calling 911 promptly is essential. Recognizing the signs and acting quickly can significantly impact the outcome. Transient ischemic attacks, TIAs, and early ischemic strokes often have similar symptoms, but in TIAs, these symptoms typically resolve within 24 hours. The symptoms depend on where the brain injury occurs, usually in the carotid or basilar arteries. Newborns may develop jaundice, causing their skin to appear slightly yellow. This condition is generally temporary and not a cause for concern. However, in rare cases, jaundice can become more serious, so infants should be monitored for it carefully. The F.A.S.T. acronym is a valuable tool for recognizing stroke symptoms and taking immediate action to improve the chances of a positive outcome. It's essential to be vigilant for these signs in the event of a suspected stroke. As for newborns and jaundice, you are correct that jaundice is a common and usually harmless condition in newborns. It occurs when there is an excess of bilirubin, a yellow pigment, in the baby's blood. Typically, jaundice resolves on its own within a few days to a couple of weeks, but in rare cases, severe jaundice can lead to complications. Healthcare providers should monitor newborns for jaundice and take appropriate action if necessary, such as phototherapy or other treatments. Recognizing stroke signs and F.A.S.T. acronym. Time is crucial. Responding promptly to a stroke is crucial, as delays in seeking medical help can lead to significant long-term consequences or disability. Types of strokes. There are two main categories of strokes: ischemic and hemorrhagic. Ischemic strokes occur when a blood clot obstructs a blood vessel in the brain, while hemorrhagic strokes result from the rupture of a blood vessel. Both types of strokes can produce similar symptoms. TIA, transient ischemic attack, also known as a mini-stroke. A TIA involves a temporary interruption of blood flow to the brain, causing stroke-like symptoms that typically resolve within 24 hours. Even though these symptoms may not cause permanent harm, they serve as a significant warning sign that should not be disregarded, as they could precede a more severe stroke. Newborn jaundice, bilirubin levels. When a baby's liver is not yet fully developed, it may struggle to process bilirubin, a byproduct of red blood cell breakdown that can cause yellowing of the skin and eyes. Treatment. Typically, mild jaundice in newborns resolves independently without requiring intervention. However, if bilirubin levels become too high, phototherapy or other treatments may be necessary to aid the baby's bilirubin processing. Breastfeeding and jaundice. It is recommended to continue breastfeeding even if the baby has jaundice, as it can help lower bilirubin levels and support overall well-being. Healthcare providers should monitor and offer guidance to follow proper feeding practices. Additional information is available on stroke symptoms and the F.A.S.T. acronym. Risk factors for stroke encompass high blood pressure, smoking, diabetes, obesity, high cholesterol, family history of stroke, and age, with an increased risk as one gets older. Making lifestyle changes and managing these risk factors can lower the chances of experiencing a stroke. The treatment for a stroke varies depending on its type and severity. Ischemic strokes may be treated with clot-busting medications such as tissue plasminogen activator, TPA, or mechanical thrombectomy to remove the clot. Hemorrhagic strokes may necessitate surgery to repair or remove damaged blood vessels. Rehabilitation is crucial in the recovery process following a stroke. Physical, occupational, and speech therapy may be required to help regain lost functions and enhance quality of life. Breast milk jaundice is a condition that can affect some breastfed babies, causing a temporary disruption in the elimination of bilirubin. This jaundice may last a few weeks but is generally not harmful. Healthcare providers closely monitor bilirubin levels in newborns, particularly those at higher risk for severe jaundice, such as premature babies or those with certain blood type incompatibilities. Monitoring helps to identify when intervention is necessary. Healthcare providers may sometimes suggest home phototherapy using specialized lights if bilirubin levels are slightly elevated but not high enough for hospitalization. It's important to remember that both stroke and jaundice are complex medical conditions with various nuances. Early detection, proper medical evaluation, and guidance from healthcare professionals are essential for effectively managing these conditions. If you have specific questions or concerns about either topic, it's best to seek personalized advice and treatment options from a healthcare provider. Whether feedback, suggestions, or just saying hi, we love hearing from our viewers. Your comments also help boost engagement and visibility for our channel.